So this is just a quick update. I just recently found out that I qualify for a dual kidney transplant. So what does that mean? That means that I get a 2-for-1 now that I'm on the dual kidney transplant list, because it's a separate list. So what that means is they take two older kidneys. They're going to take two older kidneys and they're going to put them inside me, as opposed to one younger kidney that's closer to my age. Typically, kidney transplant centers want to give you a kidney that is more close to your age. So at the time of this recording, I'm 36 years old. So it's called longevity matching. So if they give me a 30-something-year-old kidney and I'm a 30-something-year-old person, that kidney will, number one, last longer. And I'll grow in age with the kidney. It's growing with me. We're growing together. Now, with dual kidney transplant, your wait time is dramatically cut down. Because just like the hepatitis C kidneys, it's a resource that, one, not a lot of kidney transplant centers do, and two, is not really utilized. Once again, they just destroy these older kidneys that could go to patients. There's a lot of different qualifications for how you're able to get on the dual kidney transplant list. One of them being diabetes type 2 and hypertension. But a lot of the qualifications usually fall under people who are 60 to 65 and over. Like, this program is like specifically made for them, by my understanding. So younger people typically don't qualify for this program. But dual kidney transplant is not just limited to the age. The age is a huge factor, but there are also other different types of like medical ailments that, if you have them, that'll allow you to qualify for kidney transplant. Now, if this is something that you're interested in, you should, by all means, talk to your kidney transplant coordinator. Not every transplant center does dual kidney transplant. But if you want to know more information, ask them about it. Ask them about all the programs that they will allow a patient in your situation, if you are on dialysis, you're on the kidney transplant list, to qualify for, because you never know. So what is the procedure? Dual kidney transplant is just, it's standard kidney transplant. It's just like any other kidney transplant. There's nothing different that they're doing to you. It's pretty much standard. But one thing that's unique about dual kidney transplant is that they're giving you two kidneys. So typically in your body, your kidneys, there's two of them and they're on either side. But with the dual kidney transplant, from information that I've gathered, they're going to do they input the kidneys laterally to connect them to the bladder and the major blood vessels. So the two kidneys will actually be on both one side of the body. So that's how they'll go in. So from what I've been told, and don't quote me on this, in some cases, having two kidneys is better than having one. Because you have two kidneys, they're constantly compensating for each other when it comes to toxin removal, fluid removal, hormone regulation, all that stuff. And with dual kidney transplant, your life expectancy dramatically goes up, as opposed to just waiting for 10 years on dialysis. Because dialysis naturally degrades you over time. It keeps you alive, but over time, you will degrade. And ideally, medical professionals like nephrologists don't want you on dialysis for long periods of time if there is a means to get you off of it. But I will say that the saddest thing about this whole like kidney transplant thing is that I'm finding out information by accident, and that's not how it should be. All of this dual kidney transplant stuff came about based off of a conversation that I had with the kidney transplant coordinator. And I can't stress this enough. Like, it's important that you talk to these people and let them know that you're a real human being, right? Because they don't know you from a hole in the ground. And you're just another name in the UNOS algorithm that's on their itinerary of people to talk to for the day. They don't know how you feel. They don't know who you are. They don't know anything about you. But I found that how dual kidney transplant came about for me is that I just had a conversation with the coordinator. And I let her know my concerns. I let her know how much I hate dialysis. I let her know that I'm a real person with real feelings. And that, please don't just file me away in some kidney transplant center. Some dialysis clinic, and just leave me to just rot away while I'm waiting for a kidney. Like I'm ready to be done with this. And if there's something that you can do to help me, and it's just this one conversation led to one thing, and it led to her asking me questions, and then those questions led to this, that, and the other. And she, just based off of the conversation that we had, she wanted to help me. And this is her way of helping me. She put me on the Hep C kidney transplant list, and after speaking to her committee, she got me put on the dual kidney transplant list. So try not to underestimate just talking to people. Sort of read the room a little bit to see if, just based off of the slight conversations that you have, does this person actually really care about what I'm saying? Or are they just listening to me so that way they can just go do something else? But based off of my evaluation, she seemed like she really wanted to help me. And based off of this, she found a way to. And I am 100% willing to do this. If that means that I can have at least some relief. And supposedly dual kidney transplant kidneys last 12 to 20 years. And that's a long time. That's just as long as a single, healthy kidney. Now the kidneys are going to be slightly aged, but hey, 12 years, 20 years, I'll take it. It's better than, I would rather take 2 older kidneys to get me off dialysis than spending 10 years on dialysis.